Most of us think about our teeth in terms of having a bright, confident smile. We brush and floss to prevent cavities and keep our breath fresh. But what if I told you that the health of your mouth is deeply connected to the health of your most vital organ, your brain? For a long time, we saw oral care as separate from the rest of our body's health. It was about preventing toothaches or looking good in photos. However, a growing wave of scientific evidence is changing that perspective entirely. Researchers are now discovering that taking care of your teeth and gums is a powerful way to protect your mind as you age. The connection isn't just a minor one, it's a significant factor in our long-term well-being. New studies from 2023 to 2025 are painting a very clear picture. Poor oral health can substantially increase your risk for serious neurological conditions like dementia and stroke. This is a groundbreaking shift in how we approach brain health. Scientists are now urging major health organizations, such as the Lancet Commission on Dementia Prevention, to officially recognize poor oral hygiene as a major modifiable risk factor. This means it's a risk you have the power to change, putting you in the driver's seat of your future cognitive health. So, how does a problem in your mouth create trouble for your brain? The main culprits are harmful bacteria and the inflammation they cause. When your gums are unhealthy, they can become a gateway for these bacteria to enter your bloodstream. Think of your gums as the gatekeepers for your body. If they are compromised by disease, that gate is left wide open. Once inside, these bacteria can travel throughout your entire body, including to the delicate blood vessels that supply your brain. This journey sets off a chain reaction that can have devastating consequences for your cognitive function over time. This isn't just a theory, it's a biological process that scientists are observing directly. The bacteria from your mouth don't just go for a joyride through your circulatory system. When they reach the brain, they can trigger a powerful inflammatory response. This chronic, low-grade inflammation is like a constant state of emergency for your body. It can damage and harden the tiny, fragile blood vessels in the brain, reducing vital blood flow and oxygen. Over years, this damage accumulates, contributing to the kind of brain changes seen in patients with dementia and stroke, making oral care an essential piece of the preventative health puzzle. Gum disease, also known as periodontitis, often starts quietly. You might notice a little redness when you brush, or perhaps your gums feel a bit swollen. It's easy to dismiss these signs as minor irritations. However, beneath the surface, a serious battle is being waged. Gum disease is an infection of the tissues that hold your teeth in place, caused by a buildup of plaque and harmful bacteria. If left untreated, this infection doesn't just stay in your mouth. It can lead to the breakdown of gum tissue and bone, creating deep pockets where more bacteria can thrive and eventually find their way into your circulation system. Once these oral bacteria enter your bloodstream, they become systemic troublemakers. One of the most studied culprits is a bacterium called Porphyromonas gingivalis. This specific microbe is a key player in advanced gum disease. Incredibly, scientists have found this exact bacterium inside the brain tissue of deceased Alzheimer's patients. Its presence suggests it may be able to cross the highly protective blood-brain barrier, a membrane designed to keep harmful substances out of the brain. The presence of these bacteria in the brain can directly trigger neuroinflammation, which is a core feature of Alzheimer's disease and other forms of dementia. The damage doesn't stop with direct infection. The body's response to these traveling bacteria is to launch a full-scale inflammatory attack. This creates a state of chronic inflammation throughout your body, which is a known risk factor for many diseases. This inflammation is particularly hard on your blood vessels. It can cause the walls of the arteries to become stiff and narrow, a condition called arteriosclerosis. When this happens in the small vessels of the brain, it restricts blood flow. This can lead to small areas of damage called white matter hyperintensities, essentially tiny scars on the brain that are linked to an increased risk of stroke and cognitive decline. This process highlights why ignoring bleeding gums is a serious gamble for your future health. What seems like a small, localized issue is actually a sign that your body's defenses are being breached. The persistent inflammation and bacterial leakage from your mouth act like a slow, steady poison for your vascular system, including the intricate network that nourishes your brain. Every time your gums bleed, it's a potential opportunity for harmful bacteria to embark on a journey toward your brain, contributing to a cycle of damage that can silently build up over decades before any cognitive symptoms become apparent. The numbers coming from recent research are too significant to ignore. A groundbreaking study published in Neurology Open Access in October 2025 provided clear evidence of the physical damage. It found that people with gum disease had 56% higher odds of having significant white matter hyperintensities on their brain scans compared to those with healthy gums. These spots are not harmless. They are visible markers of brain damage linked directly to cognitive decline and a higher risk of having a stroke. This study gives us a visual confirmation of how problems in the mouth can manifest as tangible harm in the brain. The risks compound when more than one oral health issue is present. Dr. Suvik Sen, a leading researcher in this field, revealed in a 2025 study that the combination of having both gum disease and cavities is particularly dangerous. His research showed that individuals with both conditions had an astounding 86% increased risk of stroke. Since strokes themselves are a major risk factor for developing dementia later in life, this finding underscores the critical importance of comprehensive oral care. It's not just about the gums. The overall health of your mouth, including the absence of cavities, plays a crucial role in protecting your brain. Even the loss of teeth has been linked to cognitive decline. A massive 2024 meta-analysis, which reviewed 14 different studies involving over 34,000 adults, came to a startling conclusion. The researchers calculated that for every single tooth a person loses, their risk of cognitive impairment increases by 1.4%, and their risk of developing full-blown dementia rises by 1.1%. This suggests that maintaining a full set of natural teeth is functionally important for our brains. Fortunately, a December 2024 study from NYU offered a ray of hope, suggesting that wearing dentures may help reduce this risk, possibly by restoring chewing function and social confidence. The good news is that taking action makes a tangible difference. A July 2024 study focused on older adults who already had gum problems. It found that those who received professional treatment for their gum disease had a 38% lower risk of developing dementia compared to those who did not get treatment. This is powerful proof that it's never too late to intervene. Treating existing oral health issues is not just about saving your teeth. It is a proactive and effective strategy for reducing your risk of cognitive decline and preserving your brain function for years to come. Knowing the risks is the first step, but taking action is what truly protects you. The best defense against these hidden dangers is a simple, consistent oral hygiene routine. The foundation of this routine is brushing your teeth twice a day, every day, for a full 2 minutes each time. This isn't just about quickly running a brush over your teeth. It's about methodically cleaning every surface to remove plaque buildup. Equally important is flossing daily. Flossing reaches the tight spaces between your teeth and below the gum line where a toothbrush can't, removing trapped food and bacteria that cause inflammation. Your diet and lifestyle choices also play a huge role. Sugary foods and drinks are the primary fuel for the harmful bacteria in your mouth that lead to both cavities and gum disease. By limiting your intake of sugar, you are essentially starving these bad microbes and creating a healthier oral environment. Furthermore, using tobacco in any form is one of the most significant risk factors for developing severe gum disease. Quitting smoking or avoiding tobacco altogether is a powerful step you can take to improve not only your oral health, but your overall health, including that of your brain. Never ignore the warning signs your body gives you. If you notice that your gums are red, swollen, tender, or bleed when you brush or floss, do not wait for it to get better on its own. These are the early signs of gum disease, and they are your body's call for help. Even if there is no pain, bleeding gums are not normal. Schedule an appointment with your dentist to have it checked out. Early intervention can often reverse the initial stages of gum disease and prevent it from progressing to a more serious condition that could threaten both your teeth and your brain. Finally, make professional dental care a non-negotiable part of your health regimen. Visiting your dentist at least twice a year for checkups and cleanings is essential for prevention. A professional cleaning removes hardened plaque or tartar that you can't get rid of at home. As Dr. Sen's research showed, people who saw a dentist regularly were 81% less likely to have both cavities and gum disease. Think of these visits as an investment in your future. The small habits you build today, brushing, flossing, and seeing your dentist, are powerful tools that can help keep your mind sharp and your brain healthy for the rest of your life.